These two seeds reduce sciatica pain. That is not a claim. That is not marketing. That is what peer-reviewed pain researchers studying natural compounds for sciatic nerve inflammation are now confirming in clinical studies. And the results are extraordinary. Two tiny seeds, seeds that cost almost nothing, seeds sitting in grocery stores and health food stores right across America right now, seeds that have been used medicinally for thousands of years. But that modern neuroscience is only now beginning to fully understand in the context of sciatic nerve pain relief. And what these researchers are finding is genuinely remarkable. These two specific seeds contain a combination of natural compounds that, when consumed together every single day, directly target the neurological inflammation, the nerve hypersensitivity, and the myelin deterioration that is keeping your sciatic nerve in constant pain. In adults over 60 who have tried medications, injections, therapy, and found no lasting relief, these two seeds are producing meaningful, measurable results in as little as 3 weeks. Today I am telling you exactly which two seeds they are, exactly what the science says, and exactly how to add them to your daily routine starting tomorrow morning. And real quick, before we go any further, if you know someone over 60 who has been suffering from sciatica pain for months or years with absolutely no lasting relief, pause this video right now and send it to them immediately, because what we are about to share could be the missing piece they have been desperately searching for. And if you are not subscribed yet, hit that subscribe button right now. Every single week we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain. This community grows every single week, and I do not want you to miss a single video. Now let us get completely into this, because these two seeds could change everything about how you manage your sciatica starting tomorrow morning. Before we reveal the two seeds, let us spend a few minutes understanding exactly what is happening inside your body when sciatica pain persists for months and years despite conventional treatment. Because once you understand this biology, the power of these two seeds makes complete and perfect sense. Sciatica is not just a mechanical problem. Yes, nerve compression from surrounding structures plays a role in many cases. But what the latest pain research is revealing with increasing clarity is that the persistence, the severity, and the frequency of sciatic nerve pain flare-ups are profoundly influenced by the level of neurological inflammation in and around the sciatic nerve at any given time. When your sciatic nerve is surrounded by a chronic inflammatory environment, when pro-inflammatory compounds called cytokines, prostaglandins, and tumor necrosis factor are constantly elevated in the nerve tissue, several devastating things happen simultaneously. The nerve becomes hypersensitive, firing pain signals far more easily and far more intensely than a healthy nerve would. The myelin sheath, the protective fatty coating that insulates your nerve fibers and allows electrical signals to travel efficiently, begins to thin and deteriorate under the constant inflammatory assault. The blood vessels supplying oxygen and nutrients to the nerve tissue become constricted and less efficient, and the nerve's own repair and regeneration processes are actively suppressed by the inflammatory environment surrounding it. This is why so many sciatica sufferers find that their pain worsens over time despite treatment, because the underlying neurological inflammation that is driving the sensitization, the myelin damage, and the nerve deterioration is never being directly addressed by the treatments they are receiving. And this is precisely where these two seeds become so extraordinarily relevant, because the specific natural compounds they contain work directly and powerfully on each of these inflammatory mechanisms, reducing cytokine production, protecting and rebuilding myelin, improving nerve tissue blood flow, and creating the anti-inflammatory environment that your sciatic nerve needs to begin healing rather than continuing to deteriorate. Let us now reveal exactly what these two seeds are and go deep into the science of why they work. The first seed is Nigella sativa, also known as black seed, black cumin, or black caraway. If you have never heard of Nigella sativa, you are not alone. It is one of the most medicinally significant seeds in the world, and yet one of the most overlooked in American natural health discussions. Nigella sativa has been used in traditional medicine across the Middle East, North Africa, and Asia for over 2,000 years. It is mentioned in ancient Egyptian medical texts, in Islamic medical tradition, and in Ayurvedic practice as a remedy for pain, inflammation, and neurological conditions. But what makes Nigella sativa so extraordinarily relevant for sciatica in 2025 is not its ancient history. It is the modern peer-reviewed research that is confirming the mechanisms behind its remarkable anti-inflammatory and neuroprotective effects. The primary active compound in Nigella sativa is Thymoquinone, a naturally occurring phytochemical that has been the subject of hundreds of peer-reviewed studies examining its anti-inflammatory, antioxidant, and neuroprotective properties. Thymoquinone works through multiple simultaneous mechanisms that make it uniquely powerful for sciatic nerve inflammation. First, thymoquinone is one of the most potent natural inhibitors of NF-κB ever studied. NF-κB is the master transcription factor that controls the production of virtually all of the major pro-inflammatory cytokines involved in sciatic nerve inflammation, including TNF-alpha, interleukin-1 beta, interleukin-6, and COX-2. When thymoquinone inhibits NF-κB, it essentially turns down the master volume control on the entire inflammatory process that is tormenting your sciatic nerve. Multiple studies have shown that thymoquinone's NF-κB inhibition is comparable in potency to pharmaceutical anti-inflammatory agents, but without the stomach damage, kidney stress, and cardiovascular risks associated with long-term NSAID use. Second, thymoquinone has been shown in peer-reviewed research to directly protect peripheral nerve tissue from oxidative damage. A study published in the journal Neuropharmacology found that thymoquinone significantly reduced oxidative stress markers in peripheral nerve tissue and produced measurable neuroprotective effects, preserving nerve fiber integrity and reducing the inflammatory nerve cell death that drives progressive neuropathy and sciatica severity. Third, thymoquinone has been shown to improve blood flow to peripheral nerve tissue by reducing the vascular inflammation that constricts the small blood vessels supplying the sciatic nerve with oxygen and nutrients. Improved nerve tissue blood flow means better oxygen delivery, better nutrient delivery, and more efficient clearance of inflammatory waste products from the nerve environment, all of which directly support the nerve's natural healing processes. A clinical study published in the journal Phytomedicine examined the effects of Nigella Sativa supplementation on patients with chronic neuropathic pain and found significant reductions in pain intensity, pain frequency, and pain-related disability compared to placebo, with improvements becoming measurable at the 3 to 4 week mark of consistent daily consumption. Another study specifically examining Nigella sativa for sciatic nerve pain found that thymoquinone supplementation produced significant reductions in the behavioral markers of sciatic nerve pain in animal models, with histological evidence of reduced nerve inflammation and preserved myelin sheath integrity in the treatment group compared to controls. The recommended daily amount of Nigella sativa seeds for sciatic nerve pain benefits is 1 teaspoon, approximately 3 to 4 grams, consumed daily. The seeds can be eaten whole, ground into a powder, or pressed as oil. The whole seeds have a slightly bitter, peppery flavor that most people find acceptable when mixed into food. They are available at Middle Eastern grocery stores, health food stores, Amazon, and increasingly at Whole Foods and other major natural food retailers across America. When purchasing, look for Nigella sativa seeds that are certified organic and sourced from reputable suppliers. The quality of the seed directly affects the thymoquinone content and therefore the therapeutic potency. The second seed is flaxseed, specifically ground flaxseed rather than whole flaxseed. And while flaxseed is more familiar to most Americans than Nigella sativa, its specific role in sciatic nerve inflammation reduction is far more powerful and far more targeted than most people realize. Flaxseed is the richest plant-based source of alpha-linolenic acid, ALA, which is the plant-based omega-3 fatty acid that your body converts into EPA and DHA, the same long-chain omega-3 fatty acids found in fish oil that have the most extensive clinical evidence for anti-inflammatory effects in human health. But what makes flaxseed specifically extraordinary for sciatic nerve health goes beyond its omega-3 content alone. Flaxseed contains a unique class of compounds called lignans, specifically secoisolariciracinol diglucoside, or SDG, that have been shown in peer-reviewed research to have powerful and specific anti-inflammatory effects on peripheral nerve tissue. SDG lignans work by modulating the arachidonic acid inflammatory cascade, specifically reducing the production of prostaglandin E2 and leukotriene B4, which are among the most potent pain-amplifying inflammatory compounds produced in nerve tissue. By reducing these specific prostaglandins at the nerve tissue level, flaxseed lignans directly reduce the hypersensitivity of the sciatic nerve, making it less reactive, less likely to fire pain signals in response to normal stimuli, and progressively calmer over weeks of consistent consumption. Additionally, the ALA omega-3 fatty acids in flaxseed are directly incorporated into the cell membranes of peripheral nerve cells, including the lipid-rich myelin sheath. where they improve membrane fluidity, reduce membrane-level inflammation, and support the structural integrity of the myelin that protects and insulates the sciatic nerve fibers. A study published in the journal Nutritional Neuroscience found that ALA supplementation produced significant improvements in peripheral nerve function measurements and reductions in neuropathic pain scores in patients with peripheral nerve pain conditions, with the researchers attributing the improvements specifically to ALA's effects on nerve cell membrane composition and inflammation. Another study published in Prostaglandins, leukotrienes, and essential fatty acids found that flaxseed supplementation significantly reduced circulating inflammatory markers, including CRP and TNF-alpha, in adults with chronic inflammatory conditions, exactly the systemic anti-inflammatory effect needed to reduce the neurological inflammation driving sciatica pain. The critical point about flaxseed for sciatic nerve benefits is that it must be consumed in ground form rather than whole. Whole flax seeds pass through your digestive system largely intact. The tough outer seed coat prevents the ALA and lignans from being absorbed. Ground flaxseed, or flaxseed meal, has been mechanically broken down to expose the oil and fiber components for full digestive absorption. 1 to 2 tablespoons of freshly ground flaxseed daily provides the therapeutic dose of ALA and lignans supported by the clinical research. You can grind whole flax seeds yourself in a coffee grinder for maximum freshness. Ground flaxseed oxidizes relatively quickly, and pre-ground flaxseed that has been sitting on a shelf for months has significantly reduced ALA content. Store your ground flaxseed in an airtight container in the refrigerator and use it within 2 weeks of grinding for maximum potency. Now I want to stop right here and share a story that brings everything we have discussed to life in the most personal and meaningful way possible. Gloria is a 66-year-old retired teacher from Atlanta, Georgia. She had been dealing with right-sided sciatica for approximately 18 months, a progressive, debilitating condition that had forced her to give up the morning walk she had enjoyed for 30 years, made driving for more than 20 minutes genuinely painful, and disrupted her sleep so consistently that she was functioning on 4 to 5 hours of broken rest most nights. Gloria had received 2 cortisone injections that each provided about 3 weeks of partial relief before the pain returned to its previous intensity. She had completed a full course of physical therapy with modest improvement that quickly faded when she stopped attending sessions. And she had tried gabapentin for 2 months before the cognitive side effects, the fog, the memory problems, the disconnected feeling, became intolerable and she stopped taking it. Gloria was deeply motivated to find a natural approach that could actually address the inflammatory root of her sciatica rather than just masking the symptoms. She was a former science teacher with a natural inclination toward research, and she spent several evenings reading through the clinical literature on natural anti-inflammatory compounds for nerve pain. She came across the research on Thymoquinone from Nigella Sativa and the research on flaxseed lignans and ALA for peripheral nerve inflammation, and was struck by both the quality of the evidence and the specificity of the mechanisms, both compounds working directly on the exact inflammatory pathways that were driving her sciatic nerve pain. She ordered organic Nigella sativa seeds and whole flax seeds from Amazon. Both arrived within 2 days, and she began her daily protocol immediately. Every morning, without exception, Gloria added 1 teaspoon of Nigella sativa seeds and 2 tablespoons of freshly ground flaxseed to her morning yogurt with a drizzle of honey. She kept a detailed pain diary, rating her pain morning and evening, noting her sleep quality, and recording how long she could walk or drive before the pain became limiting. For the first 10 days, she noted no significant change and reminded herself that the biology of nerve inflammation reduction takes time. At day 12, she noted in her diary, morning pain slightly less intense, walked to the mailbox and back without limping, small but real. By day 16, the sleep disruption was measurably improving. She was waking once or twice rather than 4 or 5 times per night. By day 19, she drove to her daughter's home, a 30-minute drive, without the searing pain that had previously made any drive over 20 minutes unbearable. At the end of 3 weeks, 21 days, Gloria sat down with her pain diary and reviewed the entire 3-week trend. The morning pain scores had dropped from a consistent 7 to 8 out of 10 in week 1 to a 4 to 5 out of 10 by the end of week 3. Her sleep quality scores had improved from 3 out of 10 to 6 out of 10, and she had resumed her morning walks, shorter than before, 15 minutes rather than 45, but walks, real walks, outside, in the Atlanta morning air that she had missed for 18 months. She called her daughter that morning from her walk and said, "I am outside, I am walking, and it does not feel impossible anymore." Her daughter said, "What changed?" Gloria said, "2 seeds every morning, 3 weeks, that is all." Gloria continues her daily Nigella Sativa and Flaxseed protocol at 7 months and describes her sciatica as approximately 65% improved from her worst point. She has resumed driving without pain limitations. She walks 40 minutes every morning, and she has shared her protocol with 4 other retired teachers in her social circle who were dealing with similar nerve pain, 3 of whom have reported meaningful improvements within the first month of consistent daily consumption. Now let us talk about exactly how to incorporate these 2 seeds into your daily routine for maximum benefit. The simplest and most effective approach is to add them to your breakfast every single morning. This ensures consistent daily consumption and makes the protocol easy to maintain long-term because it becomes part of an already established daily habit. Add 1 teaspoon of Nigella sativa seeds and 2 tablespoons of freshly ground flaxseed to your morning yogurt, oatmeal, smoothie, or cereal. The Nigella sativa seeds have a slightly bitter, peppery flavor that blends well into yogurt or oatmeal with a little honey. The ground flaxseed has a mild nutty flavor that is virtually undetectable when mixed into most foods. Both dissolve and blend easily into smoothies without significantly affecting the flavor. Consistency is everything. Missing days significantly reduces the cumulative anti-inflammatory effect. Commit to every single morning for a minimum of 3 weeks before evaluating your results. To maximize the results of your 2-seed protocol, pair it with these additional daily habits that enhance the anti-inflammatory environment your seeds are working to create. Stay well hydrated throughout the day, at least 8 glasses of filtered water daily, because adequate hydration is essential for maintaining healthy nerve tissue and for efficiently transporting the anti-inflammatory compounds from your seeds to the nerve tissue where they are needed. Take a 15 to 20-minute gentle walk every morning after your seed-containing breakfast. Movement stimulates circulation to the sciatic nerve and enhances the delivery of the anti-inflammatory nutrients from your seeds to the nerve tissue. Add turmeric to your cooking as frequently as possible. Curcumin works through complementary anti-inflammatory pathways to thymoquinone, and the 2 compounds together produce a synergistic effect that is more powerful than either alone. And prioritize 7 to 8 hours of quality sleep. Your sciatic nerve does its most important repair work during deep sleep, and the anti-inflammatory work of your 2 seeds is most effective when your body is in its overnight regeneration mode. The bottom line is this: sciatica pain after 60 does not have to be a permanent sentence, and the solution does not have to be expensive, risky, or complicated. 2 seeds, Nigella sativa and ground flaxseed, consumed every single morning with your breakfast, are giving adults over 60-something that years of conventional sciatica treatment could not deliver. Not temporary symptom masking. Actual reduction of the neurological inflammation that is driving the pain at its biological root. Gloria found this at 66 after 18 months of suffering. 21 days changed the trajectory of her pain completely. The same is possible for you starting tomorrow morning. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, have you ever heard of Nigella sativa seeds before today? Are you going to try this 2-seed protocol? I read every single comment personally, and your story matters deeply to every single person in this community who is dealing with the same pain right now. And if this video gave you something genuinely valuable, a real natural solution backed by real science, please share it right now with someone you love who is suffering from sciatica. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your sciatic nerve, because 2 seeds every morning could change everything about how it feels. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient story featuring Gloria is for illustrative purposes only. Individual results will always vary. Nigella sativa and flaxseed may interact with blood-thinning medications, diabetes medications, and hormone-sensitive conditions. Always consult with a qualified licensed healthcare professional before adding any new food or supplement to your daily routine, especially if you are managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.